Okay, good afternoon. My name is Ossi Laukkanen and I come from a company called Mehiläinen. We're not exactly a startup, we are over 100-year-old healthcare provider in Finland. We have over 10,000 employees, 30 clinics, healthcare clinics, and almost 30 occupational healthcare clinics. On top of that, we have 10 hospitals, 20 dental clinics, and lots of different kind of service homes for elder people or disabled and so on. The topic was our digital clinic, and due to a little technical problems, we didn't have a HDMI plugin, so I'm going to tell you a little bit about our digital clinic. And I'm going to focus a little bit more about the whole system that we're trying to build around the digital clinic or the multi-channel, how would you say, connection with the employees in our customers' companies. Well, to put it this way, digital clinic in our mobile app is like a WhatsApp session with the doctor. It kind of sums it. It's a secure way to talk with our doctors and our nurses. You can add pictures and whatever. It's a communication layer, more of, and we still make our prescriptions and all the medical records and all that to our patient care system. And I will show you a little bit the kind of the system, how it works, and try to build the case around that for you guys. But a little sidetrack, I'm part of this trial, EHR, Digital Health Revolution study, and Aikania reminded me about it, and there is this software we install to our computers, and I have it in my iPhone as well, and it tracks all the things I do with my computer and with my cell phone. It kind of like collects the data automatically, how much I spend my time to email. It's integrated to the calendar, how much I have appointments, meetings, and so on and so on. They also collect my shopping behavior. I provided my S group shopping data as it is. That's one cool thing. I can't lie anymore how much I enjoy certain beverages in the health checkup. And then it also tracks my movements, how much I spend time to move around the city to our customers and back, and so on and so on. And that's pretty cool because it kind of relates, actually it relates really a lot to this topic that I'm going to present you. But here, this is just an example. If you think about occupational healthcare, what's the purpose of occupational health? If you compare it to just a normal doctor's appointment. The main thing is that the doctor kind of evaluates the situation, but he compares, or she compares it to what is related to the for the work, or I'm trying to find the word, workability. And that's the main thing. And now we're trying to study what's the transition to with the digital clinic compared to the normal face-to-face appointments. And now the next picture is what happens between when our customer or the patient has some problem or issue with his or her health, and when we give, or the doctor gives the conclusion what to do, what's the care in that. So this is the situation right now. If you think what the doctor has for the to make the decision what data he or she has, we have our own patient data, and then we have now Quanta, that's the national e-archive system. So we can get the data also from there. So if the patient has gone to public healthcare, we can get all the data from there. And then at this moment the patient can give us some self-measurements like blood pressure, like Teppo brought out that's the most common thing. So our patient can collect or measure blood pressure, and through Oma Mehiläinen application you can store the data there, and the doctor can see the results. So in a nutshell, at this moment we have some self-measurements and of course what the patient tells us, and then we have the patient data archive, and that's about it. And if you think about where we want to go, is that we could add some data, and Icon app is actually a pretty good example of that. I think that goes to the wellness and lifestyle data or way to work data, and this is what we are trying to build, all the information that you're gathering when you're working or working out or whatever, sleeping and all that. First of all, we need to find some way to transfer the data, and that was something we were discussing about earlier today, and which is the way to do that. But anyway, there is still the communication layer, so the patient can provide more data about him or herself for the doctor, and then still we have the Quanta e-archive and our own patient data to support the decision making. Okay, this picture doesn't contain the working environment, which is really, really important part of this puzzle when you talk about occupational healthcare. There is also apps. I can probably put it in wellness and lifestyle data. App like we're making a cooperation with Heija Heija app, which is kind of like well, it collects wellness data as well, but it's also like the Facebook of wellness in the workplace.
How do you spell?
It's H-E-I-A. But anyway, and that's the one thing. And when I talk with HR professionals in our customers, they usually say that we need to make possible to employees to take responsibility with their own health and workability. And I think that's easier said than done, because there is not a lot of tools for the employees to do that. And now this application era, like Icon app is a good example. We are getting tools to measure our workflow, or how much time do we use certain things. We can combine it with the workout data. How much do we spend time working out or jogging or whatever. But then the main thing from the occupational point of view is that how do we get the data to support the sessions between the employees and the doctor. And that's I think that's the main issue we're trying to solve here. And then I was talking with Teppo that how do we implement this on the working environment. And well, this is easy 2 slides you want the general way to work or individual way to work. And we all know that the working methods are going mobile. We can move everywhere we want. Like if I take the example of myself, I'm moving a lot. I can use my iPhone to almost get basically all my work done. And I can be wherever I want. This morning I was at my home. Busy morning, but still I got all the things done. I came here. I've been working all the time I've been here, except the tunnel, and right now I'm not discussing anything, but kind of working anyway. So I think where we could utilize the information that Iconi have and what our service should be to the companies as an occupational healthcare provider, we should be able to consult and support employees and help them to kind of develop their own way of working and help them to take the responsibility of working. And I think that's the main angle for us. And I think there is enough apps and tools now, but still the main work is to how we can combine the data for our customers, and then there is the analytics. I saw the questions, how do you analyze the data, and that's the second big issue, or not an issue, but a topic for us, how to combine the data that we have and what comes from elsewhere, because the big thing is, which is a little unfair, but the healthcare information and the data, we are the only party that can hold the data, actually. And that makes us kind of like, well, I guess there is a responsibility for us to try to enforce the development of the analysis. How do we do our work, and how it affects to sick leaves, and like everybody knows that the working is really stressful, or it can be stressful. So what kind of things we should do, not in general, but individually for each employee. And there we have lots of work to do, because if we have a, like, let's say, IT company or ICT company employing 4,000 employees, the employers really doesn't spend that much money that we could coach every individual separately. We need platforms like Heija. Heija is a good example. We can make e-queries for and try to find the focus groups that we can serve in digital platforms. We can use our experts to facilitate groups like how to sleep better, or how to eat better, how to move better, or whatever. And that's kind of the way we are going. And I hope this a little bit opened up how the system works for us and how we see it. But the main thing is, again, it's MyData conference, so the data is in the center. Even though someone might say that the people or the employees should be in the center, but really to provide the services, we need the data, and the data flow should be effortless. So in the sessions that we have with the employees, that there is as much as and most accurate data that we can use to build the kind of the way for the employee to develop his or her working abilities and so on. So